My name is Matthew Brooks. I work in the Child Life Department as the art therapist.
I'm a child life specialist and I work at Inova Children's Hospital.
I have really gotten to kind of see different things come and go in the field.
I've been using VR for about 2 or 3 weeks now, and it's been a really positive experience.
Hola, my name is Natalia.
One of the biggest benefits of AppliedVR is being able to kind of like escape reality for a few seconds.
I had a patient who had to have daily blood draws, and she was really anxious for them, and it was one of the only things that could hold her attention and keep her distracted from these procedures that were painful and not fun that she had to do every day.
It's not an iPad, everybody has an iPad now. This is something that kind of goes beyond that.
They're getting to see these creatures in their natural environment, like putting themselves into a movie almost.
Using the VR now that we have it has definitely reduced the stress and has changed a lot of dressing changes and IV starts and different areas where we just didn't have that technology.
When you're not using VR, they can look and it heightens their anxiety, but with VR, it kind of blocks everything out.
Well, we're going to change this dressing now. I'm going to put your arms straight. Good job.
One of the biggest parts of my job is making the hospital a more normal place for kids and helping kids actually feel like they can be kids. And I think virtual reality does that so well.
They get to go all over the world. Our patient would go to Machu Picchu and go to Iceland, watch the horses just running, and they were just in awe with all of it.
This is Rahul, he's 7, and he's actually a very light kid, very friendly, big chatterbox. This is his first time since he was a baby, so it was very difficult. Especially with the blood draws, and it was all a new experience, so it was really hard on him.
It's a good way to separate the mind, and instead of just thinking about all the visual pictures that you can create through words and everything, I think it allows us to really give that image and can still kind of talk along with it and having them describe to you what's going on. So it's also a way to give them some control in a situation where they have very little.
A lot of times kids aren't allowed to leave the hospital or their room or their bed sometimes, and so VR really just takes them into another setting, and it can really help with coping in the hospital and just lift kids' spirits.
Every time I brought it into a room or proposed the idea to a patient, they've almost sat straight up in bed and they were so intrigued.
It's very easy to use, very user-friendly. The patient that I've used it with seemed to really benefit from it as well.
Another tool for us to use, so why wouldn't we just integrate this into our plans?
Yeah, I would definitely recommend VR to other child life specialists.
I think our patients and parents are really excited that we have AppliedVR.
Give it to them, let them try it out, and they're just been blown away. They're like, wow.
Every single person that I've tried it with has thought it was effective and thought that the hospital should have it all the time, everywhere.
Just having the ability to give these patients somewhere to go is everything.